Hello, everyone. My name is Hannah Gracy, and I'm a health science student pursuing a career in medicine. Today, I'm going to be telling you about the relationship between drugs used to treat HIV and sleep quality. I plan to explore this relationship in Dr. Robert Cook's lab as a part of my honors thesis. The article I'll be presenting today is entitled Analyzing Sleep Abnormalities in HIV-Infected Patients Treated with Efavirenz. Before we begin, I'm going to introduce a few important concepts. Many people with HIV are treated with a combination of antiretroviral drugs. These drugs suppress the HIV virus and help to stop its progression. Unfortunately, many antiretrovirals have major side effects. One of the more common drugs used to treat HIV is efavirenz. Now, although sleep abnormalities are common in people with HIV, patients taking efavirenz seem to experience more sleep abnormalities than patients taking other antiretroviral drugs. In this study, the relationship between efavirenz and sleep abnormalities was analyzed with a variety of diagnostic tests and tools, but one of the most notable is an EEG, or electroencephalogram. An EEG is a test that measures electrical activity in the brain. Prior research has shown that efavirenz-related insomnia is characterized by a reduction in sleep time. In this study, the authors wanted to determine if efavirenz-related insomnia is also characterized by more profound sleep abnormalities, like a reduction in REM sleep, poor sleep efficiency, frequent sleep disturbances, compensatory napping, and greater sleep latency, or the time it takes to fall asleep. To determine whether or not efavirenz-related insomnia is characterized by more profound sleep abnormalities, the authors performed a prospective study with an experimental design. They used a non-random sampling method to select 26 HIV-positive participants currently undergoing treatment with efavirenz. The participants were screened, and 8 of them were excluded from the study because they had a history of mental illness, chronic sleep abnormalities, or substance abuse. Confounding variables like caffeine, alcohol, steroid, decongestant, and beta blocker usage were also ruled out during the evaluation process. Thus, 18 HIV-positive people participated in the study. 13 healthy HIV-negative individuals were also sampled to serve as a control group. Sex and age distribution were similar in the HIV-positive and negative groups. 84% of the sample was male, and the average participant age was 42. Each of the HIV-positive participants kept a sleep diary for a week, where each day they would record their bedtime, total sleep time, time until sleep onset, number of awakenings, use of sleep medications, and morning wake time. They then rated the subjective quality of their sleep and noted any daytime symptoms of sleep deprivation that they experienced. The participants were also evaluated through the use of the Pittsburgh Sleep Quality Index, a scoring instrument used to measure sleep quality. The data gleaned from these evaluation tools was analyzed by an experienced psychiatrist. After the data was analyzed, 13 of the 18 participants were diagnosed with efavirenz-related insomnia. Next, all participants, including the control group, underwent ambulatory EEG monitoring for 24 hours. During this period, the electrical activity of their brain, muscles, and eyes was recorded. The researchers also used a push-button marker to record when participants woke up during sleep. This data was analyzed by an experienced neurophysiologist who was unaware of which participants had been diagnosed with insomnia. Finally, blood samples were taken from each of the HIV-positive participants to determine the concentration of efavirenz in their plasma. The samples were taken before they had eaten breakfast 12 hours after their last efavirenz dose. The participants also completed the simplified medication adherence questionnaire to assess how adherent they were to their treatment with efavirenz. The data that the authors collected yielded some interesting results. It showed that participants with efavirenz-related insomnia had lower values of sleep efficiency than both the HIV-positive participants without insomnia and the control group. This means that they spent a smaller proportion of their time in bed actually asleep. They also had a greater number of night arousals, experienced less REM sleep, and spent more time napping during the day. all of the HIV-positive participants had higher sleep latency, meaning it took them longer to fall asleep. Although all of this data is very interesting, I was most intrigued by the results of the blood tests. Researchers found that the HIV-positive participants suffering from insomnia had a higher concentration of efavirenz in their blood. They also found that participants with a plasma efavirenz concentration of over 4 milligrams per liter were twice as likely to have less than a 90% sleep efficiency when compared to HIV-positive patients with concentrations of less than 4 milligrams per liter. The most notable results of this study were that participants with efavirenz-related insomnia had reduced sleep efficiency and shorter REM sleep. This second point is particularly notable because shorter REM sleep can cause the increased intensity of the remaining REM sleep periods. These more intense REM episodes are thought to result in incredibly vivid dreams. These results may explain why patients taking efavirenz often report experiencing intense and/or strange dreams. In turn, the vivid dreams may cause the frequent sleep disruptions that the researchers observed in participants with efavirenz-related insomnia. It's also important to note that the duration of deep sleep in all the HIV-positive participants was lower than that of the HIV-negative participants. As deep sleep is known to have a variety of restorative effects, the lack of deep sleep in HIV-positive individuals may exacerbate elements of their condition. In terms of limitations, the study's authors conducted a non-random sample that was fairly small and predominantly male. As these factors make the sample unrepresentative of all HIV-positive individuals taking efavirenz, it may be difficult to generalize the study's findings. In the future, a larger and more gender-inclusive study should be conducted to confirm this article's results. Efavirenz is known to have many neurologic side effects, including nightmares, dizziness, depression, nervousness, and difficulty concentrating. The results of this study are clinically significant because they indicate that these side effects are not just caused by a reduction in sleep time, but also by changes to sleep architecture, like the reduction in REM sleep that was observed in this study. The results also suggest that EEG monitoring may be a useful tool for patients with efavirenz-related insomnia. Additionally, the fact that the study's results show a relationship between insomnia and higher efavirenz concentrations in the plasma indicates that adjusting the dosage of efavirenz may help improve sleep in patients suffering from insomnia. In short, more research needs to be done to investigate how to adjust efavirenz dosages to improve sleep without reducing its effectiveness. This article relates to my honors thesis because I plan to study some element of the relationship between sleep and HIV. Right now, I'm planning to study either the relationship between sleep quality and HIV care engagement, or the relationship between sleep quality and cognitive dysfunction in people living with HIV. I'm interested in this topic because it's well known that people living with HIV often experience poor sleep quality, but there's a lot of debate over whether this is a symptom of the disease itself, a side effect of treatment, or some combination of the two. As sleep affects virtually every element of our lives, I've always found it to be a very interesting topic of study, and I look forward to investigating its relationship with HIV. Thank you so much for your attention, and if you have any questions, please let me know.